I am just so pleased and so honored to be here as Minister of Health to take part in such a great celebration with all of you. This ceremony marks an exciting step forward in improving healthcare infrastructure in Saskatchewan and in rural Saskatchewan. The new Radville Marian Health Centre is better meeting the needs of our patients, our residents, and their families, and it's also providing a safer and more suitable work environment for healthcare professionals to ensure quality care. In my time as Minister of Health, I've heard from healthcare providers and community members that having safe, modern infrastructure is key to delivering quality healthcare services. And it's our government's priority to ensure that long-term care residents have a safe and comforting and warm and loving place for them to live. This is their home. In 2009, we announced the replacement of 13 long-term care facilities across the province. And in Sun Country Health Region, that meant here in Radville, as well as Kipling and Redverse, they all received approval for replacement of their existing long-term care facilities. And I'm very pleased to report that all 3 of Sun Country's new facilities are up and running to better meet the needs of their local residents. Across the province, 8 of the 13 renewal projects are complete, 4 are under construction, and 1 is still in the planning phase. To date, the government has invested over $200 million towards these projects. And for the new Radville Marian Health Centre, we contributed $17.6 million towards the $22 million renewal project, making it more affordable for the community. The success of this project, the success of any project like this, but this one, is a result of so many people working together. The local commitment and the dedication of all the municipalities involved, the Radville Marian Health Centre board and staff, Sun Country Health Region, and everybody that's contributed. And it's wonderful, and I'll have an opportunity to tour the facility afterwards.
As Minister Duncan mentioned, our government sees the importance for improved healthcare infrastructure in Saskatchewan communities, and we are taking action to address the problem. The old Radville Marian Health Centre facility had been a landmark in this town since 1948. It's important to acknowledge the past, but I believe, and many of you here would agree, that the new healthcare centre is better serving residents in Radville and the surrounding area. And I've had the opportunity to go around the province and open a few of the new facilities, 8 that Minister Duncan has pointed out, and a few to go yet. And I can say the level of care and the quality of care from the facility, but also the staff that we've been seeing, is just truly second to none. So thank you very much.
I am pleased to join you today in celebrating the official opening of the new Radville Marian Health Centre. We have all eagerly awaited this day and the completion of this facility and the opportunities that it will provide. Timely access to quality health care and health services that will meet your needs, helping you stay closer to your family and friends. As Chair of Sun Country Health Authority, and on behalf of the Board, I want to thank the Government of Saskatchewan, Radville Marian Health Centre Board, the Foundation, the RMs, all of the businesses and citizens that helped make this project a reality. Your contributions will be appreciated for generations to come.
Some of you attended the groundbreaking event several years ago, a dreary, rainy day, when the fundraising committee brought the soil right into the gymnasium for the event. Since then, this great community and surrounding areas have had many fundraising events, including one right during a blizzard, to raise the total 20% to fund this project, along with the government's 80% contribution. And here we are today, in this welcoming, bright, modern facility. The house is designed to encourage our residents to maintain their functional abilities. Plan to enable and support the Eden philosophy, to eliminate the boredom, the helplessness, and the loneliness, so that our residents have a good life. The space is planned to support all our staff, overhead lifts to safely transfer residents and patients, room to move equipment, and provide privacy for all.
It's been a vision of this board ever since I joined 18 years ago. It's kind of hard to believe I've been involved in this community that long. And it's been a vision for 18 years, or longer than 18 years, for a new facility for our residents. So with the government announcement that Radville was getting a new facility, we moved one step closer to our vision. The building committee was formed with members board members and local members of our communities. And the Radville District Healthcare Foundation became a major part of this project. The local RMs in town stepped up to support this great cause. A fundraising committee was also formed. A coordinator was hired to help with fundraising for building of our new facility. Small donations from children giving money from their lemonade stand sales to large donations, for example, from the Long Creek Rodeo Association, Affinity Credit Union, Eric and Mary Chester's estate, Roy and Beth Levy, and all helping in meeting our financial commitments. I want to acknowledge two major donations. One was Frank Brackett's estate. The money he left to the foundation was to be used for a new facility. And the second donation was from Don and his late wife, Margaret McCracken. Our two houses are named in their honor.